evening to all the viewers who are watching live and will be watching on the recorded version. Just a brief, we are trying to get through with the Facebook one. For some reason, it has been deleted, but we're trying to get through it. We're trying to reincorporate it, and we are also trying to bring the Instagram too. If you are watching this on the Instagram version, let me just tell you one thing. It will be available for only 1 hour. The stream will be available on NIS for 1 hour live stream. Then after that, it will collapse, means it will turn off automatically from Instagram. So I request everyone to come to the YouTube platform by to see means to see the next parts. So without wasting any more time, let's just jump into a 30 seconds countdown time.
Good evening, sir. We are back with our 101st CME, and after a completion of 100, that is centenary episode, we are not complacent, and we are committed to do our duties on a regular basis. With us as our co-host tonight, we have our respected Dr. Debnaran Kalyani, sir. Good evening, Kalyani, sir.
Good evening. Good evening to all of you.
And with your permission, sir, that on the 101st CME, let us call upon the stage our inaugurator tonight, the young, energetic, dynamic doctor, Dr. Shatashree Ghosh. Orko, can you please? Yeah.
Good evening,
Welcome
sir.
on
Good
board.
evening.
Good evening.
Thank you, sir. Good evening, sir. Kalyani, sir. Good evening, Dr. Bidyut Mukherjee, sir. Good evening, everyone. And all the batchmates of my NI student and my seniors, juniors, my teachers, everyone. I give you a warmly welcome at, at the today's evening of a gathering. We welcome to our seminar today. We just honored to have such distinguished group of teachers and students who are joining us. And I would likely warmly welcome our guests, our speakers, Dr. Shivangi Jain, and with our inaugurator, Dr. Afsar Ali sirs, and who are generally agreed to share their expertise comments with us. So let's begin our journey and learning and discover some new things. Thank you all of you to begin here. Okay, let's start our new journey and learn something. Okay, and I just give you a brief brief discussion about the causation in homeopathy. We are all know there are just like exciting cause, fundamental cause, and maintaining cause, and from that of aphorisms, and just we like to tell about the aphorism. We know about fundamental cause in like aphorism 5, 72, 78, 79, and fundamental cause who are the responsible for the development of true natural chronic disease. I just give you a brief, just one line about everything. And exciting cause, the cause which excites to the disease, just in one line. And another thing is maintaining cause. Maintaining cause is then from the book of Organon, any avoidable noxious influence. It's from aphorism 77 and footnote, I think, aphorism 7. And another thing is the causa occasionally. It is also the exciting or maintaining cause. Causa occasionally is also from aphorism 7. And I just stop here, and Shivangi, Dr. Shivangi, Shivangi, my seniors, she will explain you. Okay. Sir, apni mute achen. Afsar Ali sir.
Am I audible?
Yes, sir.
Okay, thank you. Good evening, my respected teachers, my seniors, my dear students, and all the members of NIH Alumni Association. Today's topic is a clinical topic, that is understanding importance of causation in homeopathy. The speaker is Dr. Shivangi Jain. I know her during MD time. She was 5th batch PGT and I was 6th batch PGT. I can remember those days of her dynamic activity. I felt inspired when Shivangi used to enter the department. He always young, dynamic, and energetic girl. So today's topics, importance of understanding the causation. We are eagerly waiting to listen from him. So Hahnemann have discussed in many places about the importance of the causation. The first he mentioned in medicine of experience, where he have discussed so many points regarding the causation, so many points. And in the Organon of medicine, same in aphorism number 5, what Dr. Satashree told, just aphorism useful to the physician in assisting him to cures. Immediately in the aphorism 5, Hahnemann giving the help to the physician how he can treat a acute disease and chronic disease. That is why he is mentioning aphorism 5, useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease, as also the most significant point in the whole history of the chronic disease, to enable him to discover the fundamental cause. And in this investigation, especially in cases of the chronic disease, so many accessory circumstances he have mentioned to find out whether any cause which is producing the disease, or that may act as an obstacle to cure, or may act as a maintaining cause. So without further delay, I want to call Dr. Shivangi Jain. Now over to you, Dr. Shivangi.
Good evening, everyone. It is such a pleasure to be on this platform of NIH Alumni Association, and I really thank all the office bearers and teachers who have thought of me as good enough to be here and be able to impart the knowledge that I have gained from NIH and give it to others here. So I'm really, really thankful to all of you to give me this opportunity. And with that, I would want to, without any delay, I would want to start my presentation and, understand what causation really is. So first, I would, that today's topic is understanding the importance of causation in homeopathy. Now, first, let us understand why we are talking about causation here. You will hear from a lot of, there's a general perception in people that homeopathy doesn't look after the causation, or it doesn't give any importance to causation, or we just see the symptoms and prescribe, so we don't need to know the diagnosis, we don't need to see the other things. So I think I would be able to break a lot of those myths in today's topic, and understand that where we should be using causation as a very, very important part of the case taking in prescription, where we should not be taking causation in the analysis of the case. So with that, I would want to start today's presentation. So let us understand what is causation exactly. Okay, so causation it is derived from the word causa, which is a Latin word, and it means that any necessary antecedent of an event. What does it mean? It means that whenever there is an incident happening or an event happening, there is always something which has happened prior to it, which leads to the event to take place. So this prior happening, this prior event, this antecedent event is the cause. So it is the process of causing something to happen or exist. That is from the Cambridge Dictionary. That is the meaning of the cause. Now, in the same flow, what is exactly is effect? effect is actually the invariable consequent of the cause. So what is coming after the cause? Once the cause has happened, what exactly is coming later on is the effect. So it means to say that if there is no cause, there is not going to be any effect. Now, we know that it depends. The effect will depend on the number of or the strength of the causes. Okay, so that we will come to later. But here we are just talking about what is cause and what is effect. And without cause, there is no effect. And when we are talking of that, that means they cannot be found in nature without observation. There is no a priori knowing how cause or effect are related. We have to observe. We have to see that what is the sequence of the event happening in nature. Only then we can have the causal relationship of cause and effect in any given circumstance. Now, when we are talking of that, when we are talking of cause and effect, I would want to introduce another topic or another concept here is the adaptability of the body. Now, why we are talking of adaptability when we are talking of cause and effect, we will see later. Now, why adaptability we are talking here? You see, our bodies always is in a homeostasis, right? We are trying, the body is trying to balance all the inputs from the environment and trying to bring itself to a balanced situation where it is able to function. Now, when the body, this balancing does not happen, this balancing is not good enough, it goes beyond the capability of the body to take the surroundings or to adapt to the surroundings, the disease happens. So adaptability of the body will depend again on a lot of factors. It is also time dependent. For example, if we are going to higher altitude and we are going very slowly and we are acclimatizing and then going, after some time we will not face any problem. But if you are going from plains to higher altitude all of a sudden, then we will see that there'll be problems like pulmonary edema and other things. So adaptability of the body depends on the time which is given to the body to adapt to a particular circumstance. It also depends on the nature of the outside environment. If it is too harsh, the body maybe probably will not adapt. It also depends on the genetics. For example, like if we are people who are in the tropical regions, if they go and stay in the in the polar regions, they will not be able to adapt to that environment, because people living there have adapted to that environment over a period of time, right? Generations after generations. So they have become very used to it, things which people like us will not be able to take. So this is the adaptability of body. When the adaptability of body is broken down, disease happens. So this is a very, very important concept to understand, that where we will take the adaptability into consideration and where will we take disease into consideration. All right. So when we are talking of disease and we are talking of causation, usually the causation we will find that is not one, right? We studied in medicine also that we don't call it cause of the disease, we call it the etiology of the disease. Now, what does the etiology of the disease means? That there are many, many, many known factors which are coming into coming at one point to give rise to the disease. So this is the trio of the host, agent, and environment. So if one of these factors is not there in the production of the disease, in the in the setup, the production of disease will not happen. Remove one and the others will not be able to act. Okay, so etiology we also know as multiple etiologies. It could be germs, infectious, it could be genetic, it could be autoimmune, cancerous, it could be poison, it could be surgical, it could be injuries, any sort of external factors, known factors is what we call the etiology. All right. So now, what is the why we are talking about this concept of causation here. When we read Organon, the whole classification of Organon, classification of disease in Organon is based on the strength of the cause. That is something we have to keep in mind, and I will explain it as we go down in the presentation. It also depends on the course of the disease and the effects it is producing. So you see, when we are talking of the classification of disease in Organon, we are not talking of one thing. We are not talking of just the cause or just the symptoms. We are talking of this cause, the course, and the effects that it is produced. Now, this is very much based on the logic. And the beauty of this classification is that, it will be able to accommodate any new disease that we are able to that is discovered or named, or that comes into existence. Why I say this, we all know that in medicine, the international classification of disease keeps on getting revised, and they keep on changing the classification depending upon the new understanding of the disease that is coming. Okay, but that is not a constant classification. A disease which is classified as something today will be classified as something else tomorrow based on the causation. But this particular causation which is given in Organon is very, very logical. You take up any disease and you'll be able to place that disease in the classification of diseases given in the Organon at any point of time. You need not change that. It's extremely logical. So now I will now come to the causation. Okay, so why I'm displaying Jenga here? I'm hoping that all of you know that this is a very, very popular game, and it's a balancing game. And once it happened so that I was playing with my children. I have two daughters, and it just occurred to me that this is such a beautiful way of explaining, or classifying or understanding the causation of disease in homeopathy. So you see, on the left side we have uh, a very well balanced block of woods, and this is what a body in homeostasis looks like. Okay, so if you want to put it off balance, you will have to apply a lot of force or remove a lot of blocks. Only then it will fall. It will just not, if you just touch it or push it, it will not fall, right? So this is what a body in homeostasis is. While you see on the right hand side, the Jenga, a lot of blocks are removed. Now this particular stack is pretty unstable. Okay, a push at any point of time, or probably a wrong move, will make the block fall and the player will lose. Okay, so causation is also to understand cause. We will see how we can understand cause through this particular game. See, on the left hand side, when the body is pretty good, there is no inherent weakness in the body. What all it takes to make this block fall down is a pretty violent force. You cannot just touch it and make it fall. You have to either push it, or you have to throw it off balance completely. You need a substantial force to throw this particular stack of well balanced stack of blocks. You need considerable force. While on the right side, you see, when there is already an inherent weakness in the organism, okay, then cause which is otherwise not sufficient in itself to make the blocks fall. If the same amount of force is allowed on the is applied on the block on the left side, it will not, nothing will happen. But if you apply that particular force on the right side, you will see that the block has fallen. Now that is the exciting cause. So what I'm trying to put here is that any cause which is making the blocks on the left side to fall is a very, very strong cause. Now the cause will be so strong that the effect will always be that the blocks will fall. Okay, will fall in the opposite direction from the application of the force. Whereas on the right side, where the blocks are, there is an inherent weakness. The exciting cause, the cause which otherwise was not in itself strong enough to produce the disease or produce the imbalance, is now able to cause that imbalance because of the inherent weakness. weakness of the organism itself. So the block will fall, the stack will fall randomly. Okay, you will not be able to clearly say where the stack will fall. It can fall towards you, it can fall, the opposite side. So if you understand this game, you apply it to homeopathy and you apply it to causation, you'll be able to understand how beautifully where we will take causation and where we should not be taking causation into consideration while analyzing the case. Now let us come to this particular part. What I'm going to speak now is a little I'm talking first about this so that I'm able to make myself more clear when I talk about very, very strong causes. Okay, so in Organon, what are the causes which are so strong that we don't need to see the inherent weakness in the organism? Now we know that Hahnemann has talked about the fixed miasms, okay, and he has called smallpox, and he has called the yellow fever and plague. Some of them are called fixed miasm, and they are of such character that they do not change, the effects that they are producing do not change from person to person. The causation itself is so strong that the effect is almost similar in every, almost same, I would say, in every person. Okay, so there, when the causation is so strong and we have the effect that is very, very similar in most of the people, then the more specific medicine we'll be able to give. Now when I'm talking about specific medicines, means that we will be able to say, okay, this is the disease, this is the cause, so this is the disease, and this is the medicine. The medicine, the changing character of the medicine from person to person will not happen. Okay, so this is very, very important. So we know if it now smallpox is not there anymore, but we can say, okay, this is measles, so this is the causation and this is the medicine that we will give in these cases. All right. But what I have found is that even when we have talked of fixed miasms, and actually when he has talked of epidemic diseases, I feel that there will always be outliers. The causation will not be 100%. Okay, when the causation is 100%, you will have invariably specific medicine. Okay, but that doesn't happen in nature. There will always be outliers for whatever reasons. So we see that even for the most specific of diseases, the diseases which he has named, which is otherwise against the general concept in homeopathy, but he has named these miasms as fixed miasms, and he has named these diseases as specific diseases with specific medicines. That is because of their constant character. Okay, they are so unchanging in nature that the disease, the diagnosis, and the medicine remains the same. Now, this is about the fixed miasms. He has also talked of epidemic diseases. But the difference between the fixed miasms and epidemic diseases is this, that when he is talking of epidemic diseases, he says that the disease will be different every year. That is, we are talking of the strains of a particular virus or basically virus. Okay, so every year the strain is changing. So every year you will take a genus epidemicus, which you can apply it in your patients. So you see, there are some fixed diseases. Then there are diseases whose causation, we knew corona was the causation, right? That the virus was causation. But we have also seen that the effects were not very, very, some people were affected more, some people were affected less. That is because of the inherent weakness in the organism. Okay, so that means that itself was also not so important as a causative factor. There were other factors which led to the aggression of the disease in certain patients and the mild course in the other patient. Whereas diseases where the virulence of the organism is so much that it overcomes all sorts of constitution, you will have very, very fixed diseases. So we have, that is another the second point. So we have the fixed miasms, we have the acute miasms of character of epidemics, which are changing from year to year. The third place where he has talked about very, very specific medicines is the primary stages of the chronic diseases. Okay, where he has talked about the thuja for psychosis, and mercury for syphilis, and sulfur for for SORA. All right, so this is when the causation is very, very strong, overcoming the constitution. Now, I would want to give another example from nature to really understand, when the causation is extremely strong, we have to treat it. We will get the effects which are almost same, and we will always get the remedies which are almost fixed remedies. Okay, so let's say there's an avalanche, okay, and we know that there was a very huge avalanche that happened in Kerala recently. Now, if there's a small avalanche, then you would know that it will just take the flow of the valleys, and it will go according to the the weak points in the valleys, and it will flow there. But this avalanche was so strong that it actually took away everything that was in its path. It did not matter what the strength of the structure was. So that is another. When the cause is very, very strong, the effects are also equally strong and very certain in nature, and we have specific diseases. All right. So this is about the cases where uh, it's very, very the causation is very, very strong. I would like to make a point here about the fixed miasm. If somebody is interested, it is mentioned in chronic diseases, where he also calls them permanent miasms. All right. So one thing I would want to really highlight here is that he has given due importance to the germ theory also here. So if somebody tomorrow asks you now whether you believe in germs, you should say yes, we do believe in germs, but it will depend on the virulence of the germ, whether we are actually you know uh, taking that into consideration or not. I'll give you an example here. You see tuberculosis, right? Now we all are exposed to tuberculosis. Now, if you see, modern science says that there is a specific bacteria for tuberculosis, but we know that in itself it is not strong enough, it is not virulent enough to cause disease in every person. So we know that there is an inherent weakness in the organism which is needed to cause that disease. So here, if we come to this next slide, you see the strength of cause. If you go towards the right, you have the causation as 100%, and as you come towards the left, the causation is it becomes less and less and less and important, because the inherent weakness of the organism becomes more and more, and the other factors, the accessory circumstances or the environment becomes more strong in such cases. So here we can see that the more we go towards the right, the more specific our medicine would be. The more we come towards the left, the less specific our medicine would be. When I say less specific, that means there will not be any fixed medicine, but it will be specific to the case, not to every case. Okay, I'll give you an example. Like, we have grief. There is a grief in some person. Some people will respond by having diarrhea. Some people will respond by having weight loss. The expression of that grief in different constitutions, different people will be different according to various circumstances. Now, that is where we will have to see what was the strength of the grief. Was it enough to cause the presentation what the patient is showing to us, or was it not enough? It was not sufficient cause to cause the presentation that has been the patient has come to us with. So this is the strength of cause. This is very, very important. This particular scale and the previous slide, if you understand, you will be able to understand a lot when we are talking about the strength of cause or causation when it comes to making prescription in homeopathy. Okay, so these are some places where it has been given. Acute miasms of fixed character. This is taken from Materia Medica Pura. He says belladonna and scarlet fever, aconite and purpura miliaris. This is taken from, this is by Hahnemann. Drosera, whooping cough, thuja for psychosis, Merck for dysentery, and spongia and Heber in croup. Okay, see, here I want to, this is from the introduction of the Organon of Medicine, para 83. you see the parts which I have highlighted here. Specific remedy for a disease of never varying character, where the character of the disease is not varying according to the constitution of the person. So, what we will do there, he has given examples there: the venereal disease with mercury, the contusions with arnica, the marsh ague with cinchona bark, the recent cases of itch. This is very important. He's not talking of the old cases, he's talking of recent cases of itch with flowers of sulfur. All right. In medicine of experience, also, Master says that we observe a few diseases that always arise from one and the same cause. Example, the miasmatic maladies, hydrophobia, venereal diseases, plague of Levant, yellow fever, smallpox, cowpox, measles, and some other, which bear upon them a distinctive mark of always remaining disease of a particular character. See, we have to understand, when the character is not changing, when the effect is not changing, you will always have the same medicine. This is very, very important. And because they arise from the contagion principle, which is always the same, they also retain the character and pursue the same course, excepting regards of some accidental concomitants or circumstances, which, however, do not alter their essential character. If a remedy have been discovered for one of these, it will always be able to cure it. For such a disease always remain essential and identical both in its manifestation and its cause. This is where we are talking about very, very strong causes in homeopathy, right? So we have the primary stages, we have the fixed miasms, the diseases like smallpox and yellow fever and stuff, and we have acute miasms. Acute miasms are the epidemics, right, which are happening. So tomorrow, if somebody says that, okay, you're talking about virus and you're talking about bacteria, does it fit somewhere in homeopathic principles? You should say yes, it does. It will depend on the virulence of the organism that we are talking about. Now, another question I'm frequently asked, that you give arnica for injuries. Why is that so? Now, it was found that why we take arnica almost as a specific for injuries. And when I'm talking about specific for injuries here, let me be very clear that when we are giving arnica, the degree of the injury should be very, very, very strong. Those are the cases where arnica would work beautifully. So it was found that the manifestation, the proving symptoms of arnica was very, very similar to a case where severe injuries had happened. So that is the reason. And this was found actually empirically. It was known even before homeopathy had come into existence. So this was known empirically already, that arnica is a very good medicine for injury. And in proving, it was found that the symptoms of arnica were so similar to the symptoms of any injury happen that it almost became a specific for injuries. But mind you, where the causation of injury is not very strong, you will have many other medicines, as we have seen in that scale, depending on the constitution and the other circumstances. Your medicines will change. Arnica will not remain the only medicine in that case. All right. So this is about arnica. I will just go through from Materia Medica Pura. It says that the specific curative powers of this plant, or to find out the real remedy for the often dangerous general derangement of the health, which is caused by a severe fall, blows, knocks, contusions, sprains, or by overstretching or lacerations of the solid part. The morbid state resulting from contusions are to be cured with arnica. All right. Now, so we have talked of very, very strong causations and very, very fixed characters of diseases. Now, let us see what are the other factors, the host factors, which are actually coming into play to, which alter the diseases where the causation in itself is not very, very strong. So they are the physical character of the place where the person is staying, the mental makeup of the person, the conditions of the life, the business, what kind of food he is eating, his mannerism, habits, cultures, customs, all these things. See, we are taking not only the patient, okay, that is the reason our case histories are so long, because we also take the circumstances of the patient into consideration to understand what can be altered and where do we have to hit. That is the reason case analysis becomes so important. All right. So this is the thing. So when a patient is coming to you, you have to decide that what is it that you want to cure in a patient. A patient comes with, the patient got wet in the rain and he has cold cough and apparently seems to be a viral fever. You're not going to take the back history. You should know what you want to take now and where you should be hitting. You should take the short history, you take the acute history, you give the medicine. So where to hit is one of the main art of prescription, is what I would say. And that comes with practice, that comes with seeing patients. And you don't have to take full case in every case. You should know that what the patient has come to you for, and what is the probably the most important cause in this person that you can remove, or where you can, the point where you can hit, so that you can treat the patient. Okay, so this is very important. This is, we are all taught to learn by heart, and that this is the reason for it, why we should know. So we have to have the knowledge of disease, right, what we are dealing with. Then we have to have the knowledge of medicinal powers. That is very, very important. Of course, you have the knowledge of disease, you know everything, but you don't know your materia. So you won't be able to you will not be able to find a medicine for your patient. And you should know how you adapt that knowledge of materia to the knowledge of the disease that you have gained through case taking. So this is very, very important. And I think we can have a separate seminar itself on this particular aphorism itself. But anyways, because this is important, so it had to be given its due importance here. All right, so this is what the disease classification looks like in Organon. Okay, the first part I have actually put all the non-miasmatic causes, because they are now forming a major chunk of practice these days, and you will find a lot of cases, deficiency diseases, iatrogenic diseases, accidents, poisonings. Okay, the other last two parts where you can see acute diseases and chronic diseases are actually the miasmatic diseases that we talk about, but I will be coming to that a little later. I would be first taking the initial part. All right. So this is aphorism 77. Now here he mentions many other causations uh, of importance. What can cause the derangement of health in a person. Now, a lot of times we will see that once you remove these causes, you will see that the patient gets well, but that is not always the case, especially these days. You will have to use some dynamic medicines, some homeopathic medicines, to bring the patient back to health. So we will see each of them in detail, because these are very, very important. Please do not ignore them. Don't think that the patient has come to you with with a problem, you have to give the patient medicine. I'll give you an example. I had a case. The patient was 35 years old, and he was polio affected. One of his legs was polio affected, and he was actually limping. So he came to me for backache. Backache was something which was really, really bothering him. He had been to a couple of orthopedicians. They gave him calcium. They advised him physiotherapy. They gave him vitamin D, and nothing was helping him. So when he entered, I saw him limping, and when I asked him that, uh, what is the reason? So he was not really able to tell. And then I asked him to show me his shoe. So one of his shoe was extremely, the sole was gone. The other shoe was in a good condition. So I told him, you just change the sole of your shoe, make it in a way. It had to be actually customized, because he had a slight deformity of the foot. So I told him, you get a customized shoe made, and so that the length of both of your feet is equal, and that will cure your backache. So that was it. I did not give the patient any medicine. I just asked him to get a customized shoe, and patient comes back after a month saying that his backache is much better, almost gone, and that he has now started doing some strengthening exercises as well. So you have to know where to hit. You don't have to give medicines all the time. Okay, now coming to aphorism 77. Now here, in Organon, all the causes which are not of miasmatic character, but which are very, very important causation of diseases in in your patients. That is what is listed here. So there are liquors, injurious liquors. There are prolonged abstinence from things that are necessary to support life, unhealthy localities, cellars, exercise, deprivation of exercise, overexertion of mind, and constant state of worry. Now we'll see each of them one by one. So what you are supposed to do here is, this is another thing, another aphorism where he's mentioning that we have to remove the um, maintaining causes. Okay, so all right. So you see here, now this is bad effects of morphia, okay, or somebody taking opium. So you have some patient who's coming with certain problems, and you know that the patient is an addict. Okay, so you have to first take care of that. And these are the medicines you have to, of course, ask him to stop those medicines, those drugs. Okay, you, without that, even if you continue giving medication, nothing is going to happen. So what you have to do, you have to tell the patient to stop using such addictive things, and then you will need medicines, because most of the times we have seen just these are prolonged abuse, and they actually cause a lot of changes in the body which needs to be taken care of by homeopathic medicines. So this is bad effects of noxious influences, you can say. We have effects of stimulants, alcoholism. Now various effects of alcoholism, somebody comes with jaundice, from alcoholic liver probably. You have rheumix, then you have delirium tremens, he's trying to get off alcohol, not able to do so. You have many medicines. All these medicines, why they are listed number of medicines, because the presentation of delirium tremens in different people will be different depending on the constitution, because the cause itself here may not be sufficient enough to give you a very specific presentation. All right. So then we have excessive exertion of mind. There is brain fag. You have Athusa, Anhelonium, Belisper. Then we have effects of mind exertion. We have Calibrome, and all right. So this is deficiency diseases now. Now you will see. I had a case where the patient had symptoms of peripheral neuropathy. They were tingling in hands and tingling in legs, and then we got the vitamin B12 levels done, and it was found that they were very, very low. There were some errors of diet that had happened, so we advised the patient to take vitamin B12, and that's all. And the patient was all right. There was no need of any medication. In fact, when I'm talking about vitamin D12, there is one very, very important case that I remember, and it was a case of an autism. And mind you, this particular case, I had nothing to do. I'm quoting from the case that I'm going to say. That was all done by the parent of the child. So this patient comes to me for an evaluation of her child, whether she is autistic or not. And the child is 5 years old, and I speak to the child, and she has very good eye contact, very good vocabulary, very good understanding of things. And I asked her that, why do you say that your child has autism? I do not find any symptoms of autism in your child. She told me, ma'am, when she was 2 years old, she started regressing. She started becoming very lethargic, and she started just the speech stopped, and she used to walk, and she would not communicate, and there will be no eye contact. And when I took her to the doctor, they started saying that this is the onset of autism, and she will need therapy. And then I don't know why, but I went to the lab, and I got all her tests done. And this is the patient's narrative. And there she finds that the child had vitamin B12 deficiency. And she told me that once she found that, she took one of the pediatricians in her confidence, and they started the child on supplementation. And after some time, it took a long time, approximately like 2 years, for the child to come back to normal. But in between, any other person who saw her, or any other medical person who saw her, always thought that she had autism. So she came to me after all this, and she said, "Madam, do you still think that the child has autism?" I told her that I have never heard of a case of autism which, which almost looked like a case of vitamin B12 deficiency, which almost looked like a case of autism. And this is a new learning for me, and probably new learning for all of you, where this is one of the things which we can check if there is a presentation of autism. It may not be there in all the cases, but probably if you are able to pick up 1 or 2 cases also out of 10, 20, 30, which have the vitamin B12 deficiency presenting as autism, then there'll be nothing like it, because that child needed nothing else except the supplementation with this. Okay, we will. So moving forward, we have vitamin D deficiencies coming with body aches. You don't have to give them any medicine. The iron, iron deficiency coming, anemia coming with lethargy. All you have to do is bring up their iron stores. Now here, one thing is there. We are talking of deficiency diseases. We are not talking of malabsorptions. Okay, deficiency means when there is an error in the diet or something that the person is not getting enough nutrient from outside. Not that the person is taking enough nutrient but not getting absorbed. That comes under a very different category. So this is about the deficiency diseases. Now we have another class of diseases which you will come across on a daily basis, is the iatrogenic diseases. So what all sorts of medicine you can, homeopathic medicines you can use here. You can use tautopathic medicines. You can use the simillimum which comes in the case. I will tell you, and I'll tell you a case about that. And then you can also use simply the removal of the medicine which is the culprit actually. Okay, so I had this case of asthma which I was treating. The patient, it was a very chronic case. The child had come to me when the child was 12 or 13 years old, and the child had been on inhalers since the age of 3 years. Now, I started treating. The patient was responding, but he never got. I kept on treating him for 1 year, 1.5 years, and nothing was. He was getting well. His the episodes came down, the intensity came down, but it was not going. There was something which was missing in that case, and I was not able to pick it up. Then it happened one day that I was having a chat with one of my other colleagues, and we happened to discuss this case. That is when my colleague told me that this patient, and I told him that so much of steroidal medicines has been given to this child. I don't know what to do. And that is when my colleague told me that, why don't you give a dose of cortisone to the child? And believe it or not, and I gave cortisone to that child. 201 dose, single dose was given, and the child responded beautifully. There were no attacks of acute asthma for the next 8 months after giving single dose of cortisone. There were some other small minute problems which were handled by short acting drugs, but nothing very severe happened after the dose of cortisone. Then I had another case of peripheral neuropathy in a case of CA breast, which was treated with surgery, radio, and chemo actually. And she told me that after chemotherapy, she started getting these tingling in legs, and it was so much that whenever she was wearing sneakers all the time. Whenever she would wear a chappal, it will just it will just fly, it will just come off from her foot, and she will not notice that it has come off from the foot. She will not feel the floor or the chappals under her feet. The neuropathy was to such an extent. I took the case, and this was purely on the basis of her whatever her constitution was, and I gave her platina 1 m single dose. And 4 months later, and of course, and lots of placebo to go along with it. She was supposed to report to me after a month, and she comes to me after 4 months saying that she kept on improving. She was much better. She was able to now feel her feet, and that's how she responded, like beautifully to platinum. So you see here what we are doing. We are not treating any inherent illness in the patient. We are treating basically the side effects of the drugs that she has taken. But we had to give her the medicines, the homeopathic medicines. Now, I have a lot of cases who are, also on allopathic medicines. That's how it happens in my setup. And whenever patients come with leg swelling, my first question is, are you taking any antihypertensives? Are you on amlodipine? Amlodipine is one of the major causes of leg swelling in patients with hypertension. So just ask them to go to their doctor and ask them to change the medicine, and the leg swelling will go away. The same happens with cough, chronic cough. This is so many cases I have seen. Patients who are on AC inhibitors, they will develop chronic cough. They will not get any sort of relief with any allopathic medicine. They will come to you. They will ask, doctor, I've been having this cough for last 6 months, 1 year. You ask them, they will tell that yes, the medicine was changed. You tell them to go back to their doctor and change the medicine. The cough goes away. And this bradycardia with beta blockers is a very interesting case. Actually, I had a 70-year-old man comes with a pulse rate of 45, and he was actually complaining of giddiness. That was his presentation. Doctor, I'm feeling giddy, and I feel that I will faint. When I checked his BP, his pulse, BP was fine, pulse was actually 45. Then I asked him, what you show me the prescriptions that you are taking. And it was actually advised by a cardiologist. And it was pretty shocking because I really do not know how the cardiologist missed that the medicines that he was taking were causing bradycardia. I asked the patient to go back to his cardiologist, asked him to change the medicines, and the next ECG after a month, it was all normal. His pulse rate was 66 in the next one. So this is about the iatrogenic diseases. All right. Now the unhealthy mode of living. It could be an unhealthy mode of living. It could be the occupational hazards. It could be so many other things. So here, okay, so I will talk about the occupational hazards. Now, we all are working on computer, and we are talking about long sitting hours, no exercise. So all these things, we are not meant to be like this. Humans we have evolved to walk and to run. So when we are defying our very evolution, we are bound to suffer from certain diseases. So we are sitting in front of computer, craning our neck all the time, so bound to get some neck pains. And so if you're maintaining proper postures, you're maintaining your lifestyle, you're doing proper exercises, you will not have diseases. Not all, but yes, diseases that can be otherwise avoided. Now I had a case of a person who was a mason, and he had developed eruptions in his hands. And I had given him borax. This was purely on the basis of causation. Borax was given. I opened Fatak repertory. There you will find eruptions of depending on the occupation. And I had given him borax with beautiful, just 3 days medicine, and his eruptions were gone. And similarly, constant exposure to sanitizers. Patient came to me with both the hands, severe eruptions and itching. And but yes, in this particular case, I had to take a little background into consideration, because with the short acting medicine it did not go, and I gave her sepia, and it was completely gone. This case actually, very interesting, because we have biometric as whenever we enter the dispensaries, we are supposed to do a biometric, or in the central government basically, we have biometric attendance. So problem with this patient was, he came to me that, madam, it is becoming so difficult for me to do the biometric in my office, that I had to request my office to make a separate card for me, which I could just tap or something, and I could put my attendance there, because I'm doing it 10 times, 15 times, and I'm not able to do the biometric. And he actually showed me his fingers. There were actually no fingerprints there, literally gone. And And believe it or not, after 6 months of treatment, this took 6 months actually. 6 months of treatment, he comes and tells me, "Thank you so much. Today was the first day when, with the first putting my thumb on the scanner for the first time, in the first go, it happened, and I was able to, log in to my system." So this is about the unhealthy mode of living, the occupational exposures, and other things. Okay, indisposition we have already talked about, where slight alteration in the diet will cause some problem. I have not slept today, so I will feel, sleepy the next morning. If I sleep enough, I'll be all right. If I'm I've not eaten, I'm fasting, I develop a headache. If I eat, I'll be all right. So these are small things. You really sometimes don't need to give any medication for uh, such things. These are dispositions which can be simply changed or altered by the use of uh, you know proper diet and regime. All right. Now this is very important. Now what we have talked about till now is the the maintaining causes, and we also have talked about the very very fixed, important, and very strong positions in homeopathy. Now when you're removing all this, what you're all left with is the symptoms. This is where you will give importance to the symptoms in your patients. But having said that also, you always have to take causation into the account to understand the the flow of the disease in the patient. See, you have a patient with diarrhea coming to you. You cannot say, okay, I will just see the diarrhea medicines, the different modalities, and give diarrhea medicines. No, it will not happen. You have to see the pathway through which the diarrhea has come. Is it because of some grief that the diarrhea has happened? Is it because of an epidemic or some food that the patient has enteritis and has developed diarrhea? So your medicines will change, accordingly. And you cannot just say that, okay, I will just see the symptoms and I will give the medicine. No, you have to take the causation into consideration and consider the effects. That is how you reach to a proper simillimum in your patients. All right. Now, there is another class of prescriptions which are very very easy to make. Here we have patients who are coming to tell you that this happened in the life, or this was the problem that happened, and after this I am noticing that these are the changes in me that has happened. Or you will find it during your history, or you will find it during your case analysis, that you have very very particular points in the history of the patient where you can pinpoint that this was the disorder or this was the event that happened after which the derangement of health has happened. Now these are also very important and very easy to treat, because you know that once you know the cause and you know the important, you pick up the concomitants from the effect, you'll be able to strike the medicine very easily. So the third category that we are discussing today is the obvious cause. In the aphorism 93, he says, if the disease has been brought on by a short time, in case of a chronic affection, a considerable time previously, by some obvious cause, then the patient or his friends, when questioned privately, will mention it either spontaneously or when carefully interrogated. Now, these are the things, we have anamnesis. We call it the history of past illness. So very, very important. You have a dog bite history, you think of lysinum. You have an electric shock history, after which the patient is coming with certain problems, you have morphinum. You have sunstroke, you have natrum calm. Actually, natrum calm is not the only medicine. There are a couple of them, others as well, but it is one of the main medicines. You have history of head injury, you have a couple of medicines. Now, I will tell you a case of infertility here, which I treated. And in the case was of an oligospermia case. I kept treating the case for at least 1 year, like very, very prominent symptoms of aurum. And I kept, I gave him aurum in different potencies. The sperm count improved to a certain extent, but enough to according to me that the pregnancy should have happened, but it was not happening. It was only during probably the seventh or eighth consultation the patient told me that there have been, he very casual, it was a very casual talk. Oh yeah, I have been bitten 3-4 times by a dog. And I said, why and what? So he told me that he belongs to a place where it's very very common to have rabid dogs, and as kids they would be playing outside and they'll be bitten by the dogs, and that's how it was. So that is when I gave him Lysinum. 200 single dose was given, and believe it or not, he comes after a month and he tells that his wife is pregnant, and today he is a father of 2 children. This case is almost like 10 years old that I'm quoting here. Okay. Now, in my own observation, I have also seen in rheumatoid arthritis cases. You will not find it in all the cases, but I have seen that history. You will be able to find a history of typhoid sometimes, a very prominent history of repeated typhoid. Okay, and in cases of hyperthyroidism, acute severe grief, around 3 to 4 cases I have seen of hyperthyroidism. Unfortunately, I was not able to treat them because the patients, once they found out that it was hyperthyroidism, they just went to the allopathic doctors. But I did find that in their histories, acute severe grief. So if a patient comes to you with hyperthyroidism, please ask for a severe acute grief history. All right. Now, these are some of the others obvious causes. You have apoplexy. You have a patient who had a cerebral hemorrhage or a cerebrovascular accident, and then you find that the patient becomes idiotic, not responding properly. You think of Helleborus. You have paralytic dysphagia after CVA. You think of gelsemium. You think of chest troubles developing after brain fag. It is phosphoric acid. Now, these what we are talking about are very, very specific, very, very not specific, sorry, obvious causes, where the patient is able to tell you very clearly that this happened, and that is why after this the problems have started. You have some other, these are some more rubrics. Now, influenza, we all know. You will see a lot of cases of influenza. You will have so many problems coming after influenza, and we have beautiful medicines to tackle problems which happen after influenza. There are heart troubles after influenza for Adonis, and Iberis will be able to take care. Pains which are left, lycopersicum, paresis after influenza, Beriter, Mure. All right. So we have measles. These are the sequelae of measles. We can call them sequelae. We can call them obvious cause. We can call them the most major points in the past history of the patient. We can call them by different names, but we know that these are very very prominent histories that patient will give. And until and unless, as in the lysinum case I have showed you, until and unless you are addressing these, you will not be able to go further in your case. You will be stuck in your case. So you have to address these important points in the history of the patient. So we have cancrum oris after measles, cough after measles. We have different medicines for all these sequelae. Okay. Now, so till now, what we have done, we have talked about the causations, which are very, very strong causations, so much so that we can give the name of the disease. We can name them as diseases of specific character, and we have the disease, we have the medicines which are very specific to them. Then we also have talked about all sorts of maintaining causes that can cause disease in a patient. Now these things, these were and the third was the obvious causes that we could find in the history of the patient. Now we also talked about what to understand or what to pick up in the case when the patient is coming to you. Now the patient comes to you with an acute attack. Okay, so here where the miasmatic diseases are, we are starting to talk about. Okay, now we are talking about the acute miasms. Okay, here first is the diseases which are occurring, which are attacking only individual human beings. Individual human beings means today I am very happy, I suffer from something. I am very sad, I suffer from something. I had some error in the diet, I overate, or some other problem happened, after which my problem started. It is happening, whatever is happening with me. It is completely um, nobody else around me is affected. It is only me who's affected. So the cause is pertaining to me only. There is nothing in the environment which affected anybody else. So these kind of acute attacks are individual in nature. Now sometimes you will see that the weather changes, and your OPDs or your clinics are filled with only cough and cold, or only one particular type of presentation, or you have children coming with eruptions on their hands and around the mouth. Okay, so what is happening here? It is happening here because the change in the environment, there is something in the environment which is affecting people who are susceptible to those particular changes. Now these diseases were called sporadic acute diseases. Okay, so several persons were affected by those diseases at the same time. And epidemic diseases we have already talked of, so this is something which I will not be talking about. All right, now individual causes. Now we all know individual causes will include the mental causes, the injuries, the diet errors, or anything else which will throw off the body out of balance. So we have bad effects of anger, we have dyspnea from anger, ranunculus bulbosus, we have redness of the nose during anger, we have vinca minor, small remedies here. And then we have here aphonia after long use of voice is selenium. I recently had a case where the patient had a vocal nodule, and he is a teacher and constantly speaking for long times. He came to me, he was advised for surgery, old man, around 65 years of age. And he said that I live alone and I can't undergo surgery at this age. So there were certain other things which I saw in the patient, and I gave him picric acid. Initially, I gave it only for 3 days, one dose every day for 3 days. And after that, I asked him that if he's feeling better, then no need to continue the medicine. I put him on placebo. Otherwise, I gave him extra 2-3 doses, and I told him, if you feel that your problem is coming back, you can take one dose. Otherwise, do not repeat the dose. So he came to me after 2 months. In between, he went for a checkup with the ENT specialist again. And by the time he came to me after 2 months, his nodule almost disappeared. So that was very, very obvious in his case that yes, there was an overuse of voice which led to the vocal nodule, and medicine depending on the causation as well as the effect was given with good results. Okay, now this is getting wet as a person, not when it had not as in sporadic cases. So we have so many. You will also find these cases very, very common. You are getting overheated, you're getting wet when overheated, rheumatism from taking cold. You have many other symptoms here. So you have to differentiate the cause. You have to differentiate the cause by the effects that it is producing, and you will get different type of medicines accordingly. All right. So we have bad effects of fasting. Then we have bad effects of different kind of foods in different patients. Now, bad effects of taking cold. This cold, taking cold from sudden cooling off when the patient has perspired, and body pain comes. So I have seen, a lot of times, children would come they'll be playing in the hot weather, and they will come and drink cold water, and after that if they develop fever or body ache or some other problem, nux moscata is one of the very, very good medicines that I have used in my practice for such a complaint. There are many, many others otherwise. There's ranunculus bulbosus, there's pleurisy from overheating. And then taking cold is aconite, ars, ranunculus bulbosus. All these medicines you will choose only when you are taking the cause as well as the effect into consideration. You cannot just simply go here on the basis of the cause, because the cause is not sufficient in itself to cause the problem. There is an inherent weakness in the person, which is making the cause take its hold in the person, producing certain effects along the lines of least resistance. All right, so there are some cases. Here we are talking about individual cases. A lady came to me with severe pain in neck of sudden onset, and she had a fight with her husband, and she got really, really angry. She was not able to express her anger, and as a consequence, her neck became stiff, and she came in acute pain. 3 doses of staph on him set her right. Actually, staph has been, very, very good medicine in such cases, but I have found colo, causticum, all these others also work beautifully. Okay, so there is this another case, very interesting. This patient had actually acute retention of urine. So he came to me for a referral to a hospital where he could go and admit. That's how it works in my setup. So I told him, okay, I will give you the referral, but tell me what has happened. And so he said, I don't know what has happened. I was pretty okay when I went for a morning walk. And this is I just was feeling very tired, so I sat down, and it had rained the earlier night. The stone was very cold. That's all. So yeah, so this is what I asked. Yeah, it rained last night, right? So he said, yeah, the stone was very, very cold, and when I came home, I had an urge, but I was not able to pass the urine. I said, okay, you take the reference, but you take this medicine. I gave him Nux vomica 1M. By the time he reached hospital, he had passed urine, and there was no need of any catheterization. Okay, now this is another case. Takotsubo cardiomyopathy is basically an acute dilating myopathy, cardiomyopathy, and it is also known as broken heart syndrome. So there was this patient who came to me around 45 years of age, and he was on a lot of medication for his dilated cardiomyopathy. So his ejection fraction was around 40%. Young chap, 2 children. I was really shocked to see that, and thinking of the prognosis. Anyways, I initially thought what to do. I mean, and then I took the case. I asked him how it happened, and so he told me that, madam, he was very close to his father, and since he's a central government employee, he's staying away from the family. His father was in his native place, and one day he receives a call saying that his father passed away. And that is the time he told me that, doctor, when I received that call, there was such a sinking in my heart. I just sat down on the floor, and I didn't know what to do. And after that, I think my problems, then I started having palpitations. So many other problems started after that particular incident. Now, on the basis of this, I gave him tobacco 1M. Single dose was given, and along with that, I don't know whether I should have done that or not, but yes, I did give him. If I'm not mistaken, I think I gave him Adonis tincture to be taken for a month. Now, this patient had a follow-up with his cardiologist. The next time his echo was done, the ejection fraction was 45%. And after that, I stopped his Adonis also, and I just put him on placebo, because I thought somewhere tobacco has helped him. This is given in boric, by the way. If you open boric and see that, you'll be able to find this symptom. The patient's ejection fraction kept on improving for the next 6 months on placebo till it reached 48%. After that, it just stagnated at 48%, and I was pretty happy that at least from 40% it came to 48%, and it did not get any worse after that. Not any worse, neither better after that. It was just stagnated there itself. Now, this another case. This patient came and she told me severe sciatica pain. She took couple of painkillers 4 hourly, and she is not getting any relief. And she's been to orthopedician and whatnot. She has done. She has been suffering for last 1 week with sciatica pain, severe sciatica pain. She came literally crying to me. I asked this person what has happened, and what, how many children she has. And so she told me that recently her daughter has gone to hostel, and that was like 3 months back, and 10 days back she had come home. But you know what, doctor, I did not find her that she was talking to me the same way she would talk to me, earlier. And that really hurt me. Am I getting separated from my daughter? Is she going away from me? And she was crying like anything. That is when I gave her Ignitia 1M and asked her to wait for another hour. And I told her, if the pain doesn't come down, you take another dose. So there was no need of another dose. Ignitia 1M brought down her pain within half an hour to much bearable levels, and I sent her away with another 2 doses if need to be taken. Otherwise, do not repeat the medicine. So this is all about the acute causations, the acute events that are happening in the patient's life which are causing the disease. This is how you will handle the acute episodes. Now, now we will talk about the sporadic cases. Now, sporadic cases are basically the telluric causes. They are basically causes which are in the environment which are affecting patients of certain constitutions. Okay, it will not affect all, but you will see that in your practice, suddenly you will find a lot of patients with coming with similar complaints. You will have patients coming with the cold. You will see patients coming with body aches, or so very similar complaints you will find. So these are all actually sporadic cases. Here your environmental factors, your environmental causations will come into play, and you have to take those into consideration while finding a remedy for your patient. So we have pains in the limbs caused by wet cold weather, nux moschata. You have rheumatism of hot weather. You have rheumatism of cold weather. We have many more other um, we have change weather changes causing problem. We have cold damp weather causing problem. We have summer complaints, warm weather. After cold days, complaints are coming. So all these medicines again will depend on the cause and effect. We have aggravations, and we have also the the celestial factors like moon. You will have a lot of patients coming with complaints when the increasing moon is there, when the decreasing moon is there, or the moon is full, or there is a new moon. You will have patients coming. See, sometimes what happens is you will not be able to find these problems directly. You have to actually keep a very proper uh, journal or case history of the patient, so that you can find out the patterns in the patient's history, and then be able to give the disease, the find out the pattern, and take that into consideration to find out the remedy for your patient. So you might have a patient coming epilepsy, you will take it periodically, but unless you are able to correlate it that it is happening every time on the new moon, you will not be able to reach to the medicine calibrum. So understanding the drugs and understanding what is there in the patient, that is important. If you're able to pick that up, lot of cases you will be able to cure without much problem. But you need constant study, you need constant analyzing for that, but you will be able to come to that. Okay, so you have sporadic cases. You can say treating dengue. You have here. I'm from Bangalore, and a lot of times we will have cases here. A lot of cases coming together, and all of them are needing eupatorium or arsenic album or gilsemium. It will depend on presentation, of course. And so we have you don't need to put your mind to it. You know that, okay, the weather has changed like this, the patient is coming with this problem. Okay, so these are the set of medicines which I think will be suitable in my cases now, and you can prescribe accordingly. So we have sporadic cases of hand and mouth, which were treated with our Rustox. We have change in weather in Bangalore, which I know will be taken care of by these group of medicines. So I can always fall back on these acute medicines to take care of the problem. When it comes to the chronic treatment and ensuring that the patient does not get the problem again, we have to have a different approach. Here, these medicines will not be sufficient enough. Epidemic causes we have already talked about. We find the genus epidemicus. It will be almost specific for that particular year, and it can be given to all the patients. Now, these are the prophylactics. Based on this only, based on the acute fixed miasms and the acute miasms, we have these prophylactics which can be given to patients to prevent diseases. So we are not only taking care of the disease part, we are also taking care of the health part. We are ensuring that the state of the health is maintained as it is, the preventive medicine aspect. So we have belladonna for scarlet fever, we have antium for chickenpox, pulsatilla morbillinum for measles, and many other. Okay, so there was this case, a child comes up with chickenpox, and all the patient's elder sister and both the parents told me that they never had chickenpox in their life. So I was very worried, because we all know that chickenpox, now again, if we know the disease, the knowledge of the disease, we know that chickenpox in older population is more dangerous than chickenpox in a younger population. So I was pretty worried that they should not catch the disease. So variolium was given to all of them, and none of them caught the disease, and only there was an uneventful course of chickenpox in the child as well. He recovered without any problem. All right. So this is what we have talked about. The you know the acute cases, when a person is coming with acute exacerbation of the problem during acute exacerbation, acute presentation, not exacerbation, acute presentation. So we see whether it's an acute case of sporadic character, individual character, or epidemic character. Now, anything else? Now, what we have talked about, the initial slides that I have shown you about the Jenga and the strength of cause. Now, as we go towards the more unstable state of the organism, the more inherent weakness of the organism, we come towards what we call as miasm. Okay, if you want to really understand what are the chronic miasm, I would say you just take it as a sort of inherent weakness which prevents the organism to lead a healthy life. It will always cause that tendency inside to have certain problems. Will be you can understand miasms in such a way. Now once the patient has come as a chronic patient to you, you have taken care of you have removed all the maintaining causes, you have taken care of the obnoxious influences, you know there is no acute causation of such a character that you can take care. Now what will you do with those cases? Now those kind of cases are called one-sided diseases or local maladies. Now how do we go about treating the one-sided diseases or the local maladies? Now, I will not talk about the surgical diseases, because surgical diseases, as I said, are of such an intense character, because that the causation is so much. There are accidents or poisonings or something where, of course, you need the mechanical aid. You need, you need to have the help of the conventional system and other things. But at the same time, you can always help your patients with homeopathic medicines. That definitely helps in the recovery. I have seen it so many times. So while your causation, you can treat parallelly along with the conventional system, and you will see beautiful results in these cases, much more than you would where the homeopathic medicines are not given. I remember a case of this was an 85-year-old person, and he fell down and he had a big subdural hemorrhage, and he was in hospital. The patient's relatives came to me, and they told me that he has been asked to do a butthole surgery, but at the same time they are telling that it's very dangerous in him, whether he will survive it or not. We do not know what to do. So I told them, see, personally, I would also suggest, yes, I do understand, I will give something, but there is nothing more than that I can do, and we will see how the person responds to it. The patient was 85-year-old, so I gave arnica 200. It was not even a high potency. 200 for 5 days. I gave it twice a day, thinking that probably I need to give a little more doses to ensure that it takes root in the in the patient. And after 5 days, the patient comes out of coma, and after 2 months, his uh, the subdural hemorrhage was completely gone. And but having said that, this was one of the one of the outliers, one of the outlying cases which I had treated. And it was a very difficult decision on my part to to tell the patients, okay, that we'll go ahead with the treatment, because they were so unwilling to undergo the surgery. But yes, there are places where surgery has its own importance, and we should know and draw that line there. Only then we'll be able to help our patients in a judicious manner. Okay, so here, what I'm talking about here is like brain concussion. You have these medicines. You have traumatic inflammations. You have certain medicines which you can use for your in treating the surgical cases, the local maladies of external character. These are one-sided diseases of external character. Okay, here there is no um, internal deficiency in the organism. The causation was so strong that it affected the patient. All right. Now we are coming to maladies which were actually truly local and miasmatic in nature. Now, what is happening here is that whatever is the deficiency or whatever is the problem, it has gotten located to one certain point in the patient. Now, now what will you get? You will have patients coming with moles. He will say, I have a mole. Now you take the history, you will not find anything. These cases are very, very difficult to treat. You have to sometimes go hit and trial because you don't get indications. See, our main point is, our main bread and butter is the indication. We get the indication, we get the medicine. We don't get the indication, then what do we do? So that is the reason that one-sided cases are difficult to treat. You might see that, okay, one patient coming to you with a lipoma. Okay, there is no other problem. How's your urine, how's your stool, how's your appetite, thirst, everything is fine. You're not able to find any indication in the patient. So difficult to treat, but they are also very once you treat them, they are very satisfying that that you have been able to help your patient with the problem. Now, we have talked about here in Aphorism 194 in Organon of Medicine. Hahnemann talks about the local application in local maladies, which is not actually to be done. It is not done. Okay, so I have given here examples of some of the one-sided diseases which I have treated on the basis of location. Now, I particularly feel that location is very, very important while we are treating the case. Let's say the patient comes with a wart. Why the patient has come with a wart only on that part of the body, on not or not anywhere else? Okay, or there is an ulcer. Why the patient has come with ulcer only on that part of the body? So we have to understand that that location gives us the point of weakness in the system. Okay, that is the point where that is the point of the least resistance in the body of the patient. So it becomes very, very important point when you are taking into consideration when you're doing the case analysis. So I'll show you a case here. This was a wart, and this was actually a Palmer wart. You see, it was almost 3 centimeters when the patient came to me, and this case took 2 years to treat. And actually, I would give a lot lot of credit to the patient, that the patient had enough patience to stay with me and not go anywhere. And you see on the right hand side, this is one day the patient comes to me, and she tells me that, see, this is what has happened in the last 2 months. The progress was so much, it kept on decreasing, and morning today when I woke up and I find my hand is like this. This was the case which I had treated with. First dose that was given was Talcamara 1M, and after 1 year I had given her Berita Carb 1M, single dose, 2 doses in 2 years, no local application, nothing, and this was the result. There was another case that I had. I am not having the pictures right now. I had treated it on the basis of the location. There was a heel ulcer in this patient. No other complaint. The patient was not diabetic. There were the sensory nerves were intact. It was painful, but not enough painful. Very very few symptoms. And that is one. That is when I read the Pulford keynotes, and very beautifully it is there that ulcers on the heels, natrum carb was the remedy. Natrum carb 30 was given, and single dose was given, and after 4 months the ulcer had healed completely. There is another case of varicose ulcers. This was one of my allopathic seniors, allopathic colleagues, and her brother had been advised surgery. Very, very bad varicose ulcer had happened on the foot. His nature of work was also, he was into construction, constant standing, and for long hours. So that was also an attributing factor. But there was nothing much. I do not know why there was nothing much in the history. Was it because they were not willing to come up with the answers to the questions that I had asked? They didn't understand the importance of that, or there were none in the case. I do not know that. But whatever I could find, lachesis 200 single dose was given. After 6 months, the varicose ulcer had healed completely, and patient, he was actually advised grafting, skin grafting. There was no need of skin grafting. The patient was all right. I would want to show here again another case. You can see a lot of warts here, in the hands, on the left hand side. On the right hand side, patient comes after 2 months, saying that all the warts they had fallen off. They actually fell off. I mean, it came off from the root. It just fell off one day, and morning he wakes up and he finds his hands are all clean. Sometimes when I hear these kind of stories from patients after single doses, it really, really amazes me. The power of single doses. I mean, how beautifully they work. If we give the right medicine, and if we are able to pick up the right medicine, that is, and stick to that single dose, that is the case. That is the thing. um, and I must confess here that that's not always the case, but yes, I try to do that as much as possible. So this was about the one-sided cases that Hahnemann has given in his um, uh, Organon. And okay, so a lot of one-sided cases, we can you put many other diseases. You will have patients coming with hyperlipidemia. You will have patients coming with so many other single complaints. They will have no other causation. So you try to remove the maintaining causes. You tell them to exercise, maintain a good diet, and all those things. If you still do not feel that, despite removing all those, there is the patient is not getting better, I would say that try to you can you can put lower potencies in repeated um, doses, or you can go to a higher potency if you are able to find any concomitant there. One single concomitant, one single important thing, you pick that up and give a higher potency in single dose and see how your patient improves. One-sided diseases are difficult to cure. Saying it and doing it are very very different things. Anyways, so this was all about the so once we have talked about the one-sided diseases. Now we will come to another class of disease that Hahnemann has mentioned um, in the Organon. That is the mental diseases. Very, very burning topic of today. Here you understand. So when he has talked of mental diseases, it is actually taken from all the other previous classifications that we have seen. So he mentions four types of diseases. A patient comes to you with some problem. Okay. So what can be the origin of that problem? Either it is an acute mental disease. The patient was yesterday all right, something happened after this thing happened. Okay, the patient had a birthday party, extreme joy, and after that fever started. So that is one emotional, uh, the problem that has come because of the emotions of the patient. That is acute disease. That is what we have seen in aphorism 73. So that is the first type of mental diseases that we are talking here. So diseases which have acute origin, that is the first. Then we have mental diseases which are actually one-sided diseases which had corporeal origins, but they ultimately became one-sided into mental diseases. And I think schizophrenia and many other diseases, bipolar disorders, probably they will come into these categories um, of mental diseases. Then the third classification of mental diseases that he talks about is the diseases of doubtful origin, where you do not know what has happened. Okay, whether it was from an acute episode it started, or from a or it the patient had some problem, and slowly the physical problem went away, and the mental problem came up. That is the third causation. And the fourth one is actually of a maintaining cause that we have already talked about. So mental diseases which are kept up and maintained by the constant worries or the environment of the patient. Okay, so this is body to mind. Aphorism 215, he talks about the one-sided diseases which are body to mind, actually. Then one thing I would want to point out here, that analytical repertory of mind of Herring is very, very useful repertory in cases of when you're treating mental disorders. And beautiful repertory, gives lot of modalities, concomitants, and it will give you both the causes from emotions, and it will give you the mental concomitants of the physical complaints as well. So this I use in my practice a lot. Okay, so this was a case of CA ovary that I had seen around 4 years back. The patient was operated, and she had multiple comorbidities. She was diabetic, hypertensive. She had undergone surgery and chemotherapy for her CA ovary. So when she came to me, she was like a statue. There was no eye contact. The history that I got was from the patient's husband. She did not utter a single word in her first consultation. She was also on antidepressants at that time. Now this was very, very difficult, because there was when you get patients who are already taking too many medicines, what happens is almost all the symptoms are they are covered, they are hidden, they are not shown in their true nature. So it's very difficult to treat such cases. But slowly I started, I do not remember why, but I started her on Heliborus. I gave her a high potency single dose, and after that, over a period of 2-3 years, there was a lot of change in the patient. She would, whenever she would come, she would speak to me. She would make an eye contact, and she would talk to me also. So over a period of time, we were able to stop her depressant medicines. More than that, nothing. But the patient was much more happy and much more communicative than when she had come to me first. So this is the mental causes which have broken out as an acute diseases. And here he tells about giving medicines like aconite, belladonna, stramonium, hyoscyamus, mercury, etc. All right. So you here we see now these ones are very if you're able to pick up the emotion and you're able to correlate that the complaints are because of this, you will be able to treat them with pretty much ease. But easier said than done. Sometimes we are not able to, or the patient is not, because the patient is not able to give us a proper history. That yes, because they usually won't think that this will be important to us. What has happened. So here a lot of the soft skills of the patient, the doctor, the way you communicate to the patient, the way you make them comfortable, the way you explain to them that what is important to you in helping them to treat you. Unless you make that happen, you will not get these histories. I've seen it from time and again. There are times when the patients will actually come up with a causation on which you can actually prescribe after 2 sittings, 3 sittings, because that's how they will find they will be able to make a bond with you and find rest their trust in you. Only then they'll be coming up with their personal details. Otherwise, you in the first sitting you start asking, how's your day, how are your children, what are they doing, the patients will not be will not open up with you. This is what my experience has been in general. So yes, so we have complaints from emotions, we have complaints from bad news, from chagrin, from depression, so so many other problems which are arising out of emotions. Okay, then we also have we have homesickness, we have fever after emotions, capsicum, there is guilt, uh, and mania from self acquisition is helleborus. So many other medicines depending on the causation and the effects that they are producing in the person. So we have illness from the death of the near ones. Then we have unhappy love, unfortunate love, all these things. All right, this is from Borek repertory, emotions causing different problems and their medicines. Okay, so this was about the acute emotions. Now, um, generally what happens is we should never think that okay, so we have treated the acute emotion, now the patient will be okay and will not come back to you. No, it doesn't happen. What we have actually done is treat the acute episode. The actual inherent illness, the weakness of the patient persist. Okay, and this was actually the reason why, in the first place, Hahnemann was able to discover the chronic miasms. He was treating the acute cases. He was always getting good results with the acute cases, but he realized that when repeatedly patient came with the acute cases, after some time, what he was giving initially stopped working. The patient was not getting better anymore. So here also, the same thing goes, that you have treated a patient with an acute episode. Your patient gets well, you give the medicine, and patient goes away happy. But you know let me caution you here that it will actually patient will come back to you with some other problem again until you treat the inherent weakness or the chronic miasm in the patient. So in aphorism 222, he says that a patient who has recovered from an acute mental emotional disease by the use of non-antipsychotic medicines should never be regarded as cured. On the contrary, no time should be lost in attempting to free them completely by means of a prolonged antipsychotic treatment. For the chronic miasm of the sora, which it is true has now become once more latent, but is quite ready to break out anew. So we have to we should know that the patient can come back with the illness again if we are not treating the underlying weakness or the underlying chronic miasm in the patient. So, the third category of mental illness is the illnesses of the doubtful origin. Now, here, how would you know that? Sometimes the patient comes with, okay, the mental illness is there, and you do not know whether. See, we are talking of causation here, okay, from where the problem has started. Now, you don't know. The patient is not giving you anything. So you will see that there is a class of patient to whom, when you talk to them, they will say, "Oh, we really felt nice talking to you, and this was a good advice. Yeah, we will try to, think about it." That is one class of patient. The other class of patient, you will see that when you are talking, you are trying to alleviate their problem, or trying to console them, or trying to, give them uh, um, some directives. They will get very irritated. They will not be very receptive to your complaints, to your suggestions, sorry. So here, so that is how, this is the guideline which is given in the Organon, that this is how we will differentiate between the two categories of illness, whether the ones which were of mental origin directly will feel better by our such behavior towards the patient, whereas those which became one-sided because of they went from corporeal disease to the mental disease, those kind of patients will not be feeling better after your suggestions and advices. So you see schizophrenia, if you see, you will see that patients, you cannot argue with them, you cannot tell them what is to be done, because that understanding will not be there. So you know that this is not actually a mental disorder directly, but you have to search for the corporeal symptoms which had happened before the mental disease had arrived. So those were the diseases of the doubtful origin. Now the psychosomatic, mind to body, we all know these are actually the problems, the diseases which are kept by the emotional causes, and we know them as psychosomatic today, in today's parlance. So we know that, there are, the patient has a lot of worries, or there is stress in the environment, and because of that, the problem is happening. So there is anxiety and vexation and wrongs and fear and fright, and all these things are there, which are keeping up the emotional disease. So initially, what you will do in psychosomatism with such diseases, you will try to advise the patient. You will try to tell them how to handle their problems, or advise them accordingly. But when you find that despite doing that, or despite the patients changing their behavior or their nature, there are still some complaints which are left, you will have to actually treat them with antipsychotic medicines. This is what aphorism 226 says. All right. So okay, so this is body to mind approach to patients. Now, so this was all about the mental diseases. So till now, in the chronic diseases, we have talked about the one-sided, how to treat the one-sided diseases, how to treat the mental diseases. Now we come to the third category that he has talked about, is the intermittent diseases. Now what do we mean by intermittent? Intermittent means that diseases which are happening for a short period of time, and then going, and then again happening, coming back, happening again. So there is a class of intermittent diseases. It is epidemic and sporadic intermittent fevers, non-febrile periodic affections. They're alternating diseases. They are intermittent fevers which are not epidemic or endemic in nature. And then we have endemic intermittent fevers. They are the four types basically which has been described in the Organon. All right, so I will be taking one. All right, so it starts from aphorism 231. Now, so first he talks about the alternating diseases. So what is happening in alternating diseases? That first one problem is happening, and then that problem goes, and another problem happens. So we will find a lot of rubrics in our repertories where we will see that like we have platina, mind symptoms alternating with physical symptoms. So when the patient is mentally good, then physically he will not be good. If he's physically good, then mentally he will not be good. So you will have alternating diseases. You will have many other alternating symptoms which will be there. You can find in the repertory. So the thing is that unless you have unless either the patient is intelligent enough to understand that When this is happening, the other thing is not happening. Either the patient will tell you, or you have to decipher it yourself through your case history, and you will not be able to decipher it in the first sitting. Believe me, you have to have 3, 4, 5 sittings before you can actually come to an understanding that, oh, the patient is actually coming to you with an alternating disease. Okay, so here he says that alternating diseases can either be because of SORA, sometimes they can be because of the syphilitic miasm also, in which you have to alternate, you have to treat with the antisyphilitics as well. Okay, now there are typical intermittent diseases, and there are intermittent fevers. Okay, so intermittent non-febrile states that come and go in a periodical manner. Okay, so they will come and then they will go after. Sometimes you can talk of migraines will come under this category. There'll be a lot of neuralgias which will come under this category. So when a patient with the migraine comes, you know that, okay, migraine will come because it's periodical in nature. By your knowledge of the disease, that this periodicity, there is periodicity to that particular disease. So you will think of intermittent diseases as a classification, and you will try to treat them accordingly. Then you have intermittent fevers. Now intermittent fevers are actually mostly okay. So first let us finish this non-febrile periodical diseases. So what he's saying, that they are purely soric in nature, but sometimes they can be syphilitic, so you might need to give antisyphilitic. And because they are periodic in nature, a dose of cinchona bark will also be needed in these cases. So these are the places where we are getting the prescription tips from Organon itself, that you have an intermittent disease and you have a periodicity there. You please think that you might need to give cinchona china as an intercurrent remedy at one point of time in that case, to ensure the complete recovery of the case. So I had this case of migraine, and interestingly, she came to me 2, 3 times. She came to me first on the, she had pain on the left side, then next time she comes, she had a pain on the right side, and third time she had pain again on the other side. That is when I asked her, so the 2 times I treated her with whatever was coming at that time, some medicines. Intensity came down, but it was not really satisfactory result. I the It was like, okay, the patient is getting better, but not the way she should have had been. Third sitting she comes, and the when I check her case history, and I find the pain has again come to the side where when she had first visited me. That is when I asked her, is it always like this, that the pain is going from this side to that side? She said yes, and lacaninum 1 m was given in that case, and there was no need of any other medication in that case, and she was completely free of her migraines after that point of time. So we have trigeminal neuralgia occurring at regular intervals. So we will put them in the classification of intermittent diseases. This conium case, the third case that I'm discussing here, suppression of menses in winter, very very interesting case. This case I treated for 4 years before I could get any result, and that is only because I had maintained the case history of the patient for 4 years, and the patient kept coming to me. So what used to happen, that every time the patient would come only to me around the month of November or December, saying that her menses have not appeared, and by February onwards her menses would be regular again, and this kept on happening for um, year to year. And I was, I got her all tests done. There was no PCOD, there was nothing, and I was not able to. I gave her various medicines, no result. And that is when, in the fourth year, when I saw that every time, that pattern, I saw that every time in winters she's coming to me for a treatment of her periods. Then I asked her about all the other months of the year, and she said her periods were always normal. It is only during the December and January that, when she reflected back, she said, yes, this is what it is. She doesn't get her periods during that time. On the basis of that, I do not remember which repertory, but this was very difficult to find that suppression of menses in winters, and I found conium was the medicine, and it worked beautifully on her. It was given in high potency single dose, and she did not suffer from the same problem afterwards. So these are non-febrile periodic diseases. Okay. Now we are talking. Now we will come to intermittent fevers, which are not endemic in nature. Now, not endemic in nature means they can either be sporadic in nature, as we have seen in the acute diseases in aphorism 73, or they are epidemic. So we have to treat them like that only. And how we treat them is depending on the stages, because they will generally have 3 stages of chill, heat, and sweat. So what he says, he has told that you take whatever is the most prominent, and or the 2 stages, or if you're able to match the 3 stages, you take that remedy, and it has to be given at the end of the um, of uh, the attack of the paroxysm. The medicine should not be given at the start of the paroxysm. So this is very, very important. This is basically like an epidemic disease only. That is how you will come to the medicine reach the medicine, but the nature is intermittent. All right. Now, what will happen sometimes? Now, this will also be applicable to epidemic diseases in aphorism 73. Now, what you see that you have given the medicine to the patient, you have given the genus epidemicus, you have treated the case, but once the acute episode goes, you find that patient has some chronic complaints which have come up or which are not going. He will either have a chronic cough or chronic pain somewhere in the body, or some skin problem has come up, or something which is there which is not very easy to treat. So this is nothing but you have to treat it like a chronic miasm and give the medicine accordingly. So you have to give an antisoric medicine at that point of time. So this is what we have talked about epidemic of intermittent fever as given in aphorism 241. Okay, so same thing, improperly treated epidemic. Now, the here improperly treated epidemic means those which have been given a lot of allopathic medication, lot of other medication. So here you start the treatment with sulfur or hypersulf initially, and then you can go further from there. Now, um, there is another class of intermittent diseases where there are intermittent fevers which are not sporadic or intermittent or epidemic in nature, but they are affecting a single person not residing in Mashi district, because he wants to exclude the endemic diseases here. So once that is you have removed that and you find that the intermittent fever is affecting one single person, it is nothing but you have to treat it as a chronic disease and give antisoric medicine to such a patient. Okay. Now, endemic intermittent. Now, endemic diseases basically, it's basically because of the environment of that place. Okay, so we have talked about the adaptability in the initial part of the presentation. So some people will get habituated, they will become used to that particular area, they will not be affected. But those people who are not habituated to the area, when they come to such places, basically when they come to such places, they will get affected by the endemic problem there. There you can actually give them cinchona bark. That is the medicine which needs to be given initially, and then you can further it with any antisodic treatment if needed. He also says it's an endemic area. If the patient is removed from that area, the disease will automatically go away because it acts as a maintaining cause. Now, when we are talking of endemic intermittents here, here he has only talked about the marsh fever or the org fever, but I have seen that is not the only place of where we can think of endemicity. We can think of endemic goiter, and we can think of endemic respiratory problems which are there in an area where I stayed. So here I see that patients will come and tell me that the moment they go out of Bangalore, their allergies will go away and their nose will open up, and there will not be any problem. So I personally have found that a lot of antipsychotics are needed here, and mixed with, of course, antipsoric followed by antipsorics, and they work beautifully. So this was only on the basis of this intermittent endemic diseases that I was able to decipher that my patients will need this kind of a treatment. So the endemicity of the allergic diseases in Bangalore is treated on the basis of this problem only. So I would want to quote from Park's a textbook of preventive and social medicine here, that the web of causation does not imply that the disease cannot be controlled unless at multiple causes or chains of causation, or at least a number of them, are appropriately controlled or removed. This is not the case. Sometimes removal or annihilation of just one link or chain may be sufficient to control the disease, provided that link is sufficiently important in pathogenic process. We have to emphasize on the word sufficiently. But this is only when we talk of preventive medicine, they talk of the host agent and the environment factor. So we go beyond this, further than this, and we ensure that only the external causes of extremely severe character are able to affect the constitution, and we are able to remove the inherent weakness in the patient. So with this, I would want to end my presentation here, and I would hand over the uh, platform to Dr. Afsar Ali now. Thank you so much. Dr. Afsar Ali? Dr. Afsar Ali, can you please take over? Dr. Arka? Yes, Dr. Afsar Ali, you can take over, please.
Hello, am I audible?
Yes, please. Yes.
Hello, acha, okay. Okay, thank you, Dr. Shivangi Jain. It was a very nice and informative discussion, really. We have learned so many things from this discussion, and I hope this will help us in our clinical practice. Actually, disease is a journey of the sick person, and whenever a disease is developed, there is some cause. Always there is cause. Unless there will be no effect. We believe, as per Hahnemann's view, ki cause and effect concept. If there is effect, there must be some cause. So, where from we can get this cause? The history of patient complaint. That history of patient complaint is very much vital thing in our case taking. And Dr. Shivangi Jain very nicely discussed all the points. He covered all the points that we should take care while taking a case, especially the past history or history of present complaint. Starting from the fixed miasm, just I am touching the few points that most important point that Dr. Shivangi Jain touched, that is the fixed miasm. Disease may continue after the occurrence of any epidemic disease. Even 20 or 25 years old asthma in got cured with single medicine of carboveji. If we open the Allen's keynote, asthma dates from measles. One of the in my clinical practice, 25 years old standing asthma. So apart from that, primary stages of the all three miasm, whether that is suppressed, how it was treated, how the secondary manifestation was developed after that, that we have to inquire. And the deficiency disease very nicely discussed by Dr. Jain, Dr. Shivangi, we have to be very cautious about the manifestations. May not it be a disease, miasmatic disease, it may be due to the vitamins or mineral deficiency. And if we can recognize the deficiency, which vitamin or minerals, if we can provide from outside, we can very nicely tackle that condition. And after that, the iatrogenic disease, the most important, especially in today's context, that is iatrogenic disease. Not only from the allopathic medicine, sorry to say, we are getting cases from the abuse of the homeopathic medicines also. That we have to take care of. And the medicine patient, how to tackle, very nicely discussed by Dr. Shivangi Jain, especially with the use of the orthopathic medicine, that is the cortisone. It was a very nice case, cortisone 200 single dose. Really, it is inspiring. Then we have to search the cause of the disease, that is from the unhealthy mode of living, accessory circumstances. Hahnemann shouted in so many places that give importance to these accessory circumstances, because there lies the cause of the disease. Unless we remove this cause, we cannot cure, or from there we can get the cause of the disease. And if we see our Metamedica, in almost every drug we find there are some lines, key ailments from or ailments after or sequelae after, almost every drug. And this is so characteristic, if we can prescribe basing on this single point, the case will definitely be cured. Another is occupational hazards. If we cannot remove that occupation, or if we do not give the advice how to manage, then disease we cannot cure. Next, the indisposition or causa occasional is the importance of indisposition and causa occasional is very nicely discussed by Dr. Shivangi Jain. By only the presence of mind, that is a Hahnemann told physicians, five senses should be very acute, and with the use of these five senses we can very easily diagnose the patient is suffering from indisposition or causa occasionalis. And there is obvious cause, very nicely discussed. Obvious cause, which it is very difficult to get during the fast or fast 2-3 sitting, I think. That is why case taking is an art, and it is the art of the physician that he have to find out this obvious cause. Unless we find out obvious cause and remove, we cannot prescribe medicine. And the past history, very nicely discussed. Past history, basing on that past history, we can prescribe. Only the single medicine can cure if the disease is caused by the past disease condition. Next, very nicely discussed about the sporadic diseases, how to tackle that sporadic disease with indication of the medicine, importance of the environmental factors, so many factors. Some questions are coming, and I will forward this question to speakers. And next, the true natural chronic disease, how to cure that true natural chronic disease, very nicely cited the aphorism number 5. Then one-sided disease, how to tackle that one-sided disease. And mental disease and intermittent disease, very nicely discussed. One thing that I want to share, the concept of the Hahnemann regarding the cause of the disease. Hahnemann very nicely discussed about the nature of the exciting cause. Okay, aphorism number 31. I am reading the line. Every word is just listen, please. The inimic forces, that is the cause of the disease, partly psychical and partly physical. Hahnemann classified the cause of the disease into two groups, that is partly psychical and partly physical, to which our terrestrial existence is exposed. we are termed morbific noxious agent, do not possess the power of morbidly deranging the health of man unconditionally. Here comes the importance of the host and agent environment in the role. But we are made ill by them only when our organism is sufficiently disposed. Here comes the question of the virulence of the organism, or in cases of viral infection or bacterial infection. So we are only when our organism is sufficiently disposed and susceptible to the attack, then only we become sick of the morbific cause that may be present and to be altered in its health. And thank you, Dr. Shivangi Jain, also for enriching us about the different cases from your personal experiences. So many cases that we have learned from you. And one thing vital is that you have given on single dose and waited for 1 year. This is really encouraging for us, especially in today's context when we don't believe in on the single prescription, and you have cited the example of cases where you have waited for 1 year giving on single medicine and the single doses. Thank you. This is really encouraging for us, for all the audiences. Orko, the question. So one thing on ask the references book of the cause and effect. One book I can refer that is written by Dr. Shivangi Jain, the today's speaker, very good book. We can have a look of that book from where you can prescribe very nicely. That book is the book of cause and effect and its homeopathic remedies, and it is published from the Delhi, that is Sidh Communication Private Limited. Dr. Orko, Acha, okay. That book I will request all the readers. The book is with me. I purchased this book. Book is very good and will be very much helpful in clinic also. Any other question? Any other question from the audience? I think no question. Okay. Dr. Orko?
Yes, sir.
Should I conclude?
Sir, now I should I should tell, say, I should ask Kalyani sir to say something. As
okay, should I ask? Should I? Acha, okay. I am telling sir. Okay, I am calling. Okay.
No, he is on screen. He's on screen.
Okay, okay, sir. Okay.
Sir,
Over
Kalyani
to you,
sir,
Dr. Kalyani sir.
For your inputs.
Thank you many thanks. A great moderation, fantastic moderation by our beloved Professor Syed Afsar Ali, and beautiful presentation by Shivangi. Excellent, covering all corners. Now, I think this is the lengthiest CME by one speaker. I pray to Almighty to give blessings to our beloved madam to keep his energy in this level throughout her life. We will get many things from her. Thank you very much.
Thank you,
equally thanks to our inaugurator, Madam Ghosh. Now, I think all the corners have been covered by two brilliant scholars of our world. One is professor from National Institute of Homoeopathy.
I'm here.
Pardon? Another is from alumnus of NIH who are very expert in medicine but became very expert in Organon after coming in NIH. This is a very fantastic information for all of us. To the extent that he has published a book which has become appreciated by a learned scholar of National Institute of Homeopathy, Professor Syed Afsar Ali. So anyway, what should I want to tell you a few words only. It is already too late for the day. That in the universe, homeopathy is the only system of medicine who treats the root. And that root is exactly, as Shivangi was telling, the cause of the disease. A symptom, not even a symptom, is complete without its causation by the patient, and no case is complete without assuring or without assessing during evaluation and analysis the causation of the entire case. Then the case is complete, and you have learned from Shivangi that many cases simply can be cured by causation. But in every cases, we have to conclude the root of the disease, the causation, after anamnesis before prescription. So all of us who are prescribers with few symptoms, by neglecting each points of the symptoms and this in general evaluation of the whole entire case, whether it is physical, sociological, socio-physiological, mental, psychosomatic, whatever may be the cause of the entire case, is very, very important for selection of the final medicine. So anyway, the remarkable seminar, this should be an asset of our alumni CME. I request all of you to come forward with your next preparation. I'll be waiting for you. All will be waiting for your next presentation. Thank you very much to all.
Thank you, sir.
Thank you.
Thank you, Dr. Shivangi ji.
Thank you,
Thank you,
everybody,
sir.
to give me this platform. Thank you so much. It's been a pleasure.
Very nice.
Thank
All
you,
of
sir.
us are happy by your presence. I think Bidyut has become busy. Orko,
Yes, sir. So taking everyone backstage, and let's just conclude today's CME by telling a few words about IT. So thank you all, and thank you to all the panel
thank you all.
members who have joined today. I am taking everyone backstage just to talk about this IT thing. So with your permission, everyone, sir and ma'am, I am taking everyone backstage. Is it fine?
Sure, sure. Please.
Okay, okay, sure. Thank you, everyone. Thank you, and good night.
Thank you so much.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like. Means do the thumbs up. And we are sorry to inform that we were unable to do it on Facebook since we had some scheduling difficulties for which the Facebook private authorization that something Vagera types have removed our link. So this video is only in, it was live on Instagram and it will be kept as a recorded version in YouTube. So if you are seeing this link, you are getting this link from Facebook, then all to you. And one more thing, to get the means the link for purchasing Dr. Shivangi ma'am's book will be in the description below. If you are seeing this in the recorded version, I hope it's given in the description by now. And while on live stream, let me just tell you, it will be given soon in the description below. Just keep a check on the description. And okay, I just got a word from my IT that it will be uploaded in the description as soon as this live stream ends. So keep a follow up on the description, and the book will be available. The book purchasing link will be available over there. So again, thanks to everyone for staying for this long. And if you have enjoyed, let me tell you again, if you have enjoyed the CME, do make sure to share it with your other fellow colleagues and other batchmates and anything. And also do make sure to subscribe our channel, hit the notification bell, all button to get more updates like that. It's 101st, and we are more likely to bring up more and more CMEs ahead in future. And again, if you want an e-participation certificate, the link is in the description below. Oh, before that, let me just tell you one thing. We have a Telegram channel. So join over there. We give updates to that. Also, we have a WhatsApp channel. Join there too. And again, we have an Instagram page as you have seen. So you can just go there, follow us, like us, and to the channels, just go join there. All the links are given in the description below. And we are trying to again restarting those Spotify broadcast that. So we have given the playlist link to in the description below. Just go and check it over there, and do make sure to follow that too. Also give it a like over there too. So with this, thank you all. Good night. See you in our next semi. Until then, it's me or Mukherjee, your IT manager, leaving.